On November 15, Dr. Jum Yang treated Nesa's warts with a cryotherapy procedure that involves spraying liquid nitrogen to instantly freeze and destroy the affected tissue. It was performed in 3 15-second cycles. On December 20th, more than a month later, Nesa went back to Kaiser for a procedure which was performed by an unsupervised podiatry student. The student would perform a debridement of the 2 plantar lesions using a number 15 surgical blade. Then liquid nitrogen application was delivered, again excessively over the open wound, causing severe harm and nerve damage to Nesa's foot. After the liquid nitrogen treatment, Nesa was instructed to use Metaplast salicylic acid pads and duct tape them over her foot. Not long after leaving the hospital, Nesa called the doctor's office to complain about the amount of pain she was in. She was given pain medication and sent on her way. On December 21st, after using the Metaplast for 1 day, Nesa called the 24-hour nurse helpline because of the excruciating pain. She was told to just go to the ER if she was in so much pain. On December 22nd, Nesa went to the ER and was told that the pain was normal and to go home. On December 27th, after several days of agonizing pain, suffering, and inability to walk without crutches, Nesa's foot began discoloring and swelling, forming a large bullae. She was diagnosed with left foot hematoma. The bullae, measuring 5 centimeters, was de-roofed and dressed with Zeroform and dry sterile dressing. On January 9, 2014, Nesa visited Dr. Iran Matalon at Brookwood Internal Medical Associates, where she was diagnosed with frostbite injury measuring 7 centimeters by 3 centimeters due to too high of therapy. In July 2014, it was further concluded that Nesa suffered serious nerve damage to the superficial peroneal nerve, plantar digital branches of the medial plantar nerve, and Vallieix phenomenon was noted over the left sural nerve and lateral sural cutaneous nerve. Nesa's life has turned into a nightmare ever since the procedure that was performed on December 20, 2013. Nesa continues to suffer today, presently diagnosed with RSD, reflex sympathetic dystrophy, which is commonly referred to as complex regional pain syndrome, a direct manifestation of the injuries caused by the negligence of Kaiser Foundation Health Plan, Inc.